staff. We also got staff gym memberships too. And we did a swimming group and a treadmill test by the prescriber. So that was a fun, creative idea. We're still doing that. We have several staff that are yoga instructors and personal trainers and martial arts instructors. So it's also incorporating that those staff skills aside from the therapy into working with the clients. We are enrolled in the WIN group, ECS is, and it's wonderful, and PACT will be enrolling next, and I recommend any other program that has acute diabetic clients that are complex cases that you need more consultation with to enroll in this. This was Paul Thompson's idea.
Ravenna, can we just quickly say WIN is Wellness Initiative at Navos. Do you want to do just a brief?
Wellness integration.
Well, and tell what that does. Give 3 sentences.
Well, so we focus in on clients who have medical and mental health challenges, and it's a real collaborative, interdisciplinary effort. The case manager is usually there, the prescriber, if possible, and then the representatives from public health, Xochitl and Meredith, are usually there, and we discuss the clients from a collaborative perspective where we're talking about, okay, their diabetes is uncontrolled, how can we help them through the behavioral side to remember to take their insulin on at the same time every night, for example. How can we help this client who's in a very volatile home situation be successful with their blood pressure medications and monitoring their blood pressures. So it's really kind of coming at things from an interdisciplinary approach and really trying to problem solve on those tough clients that we have so many of. So it's a very focused kind of group on those specific clients that are identified both by public health and by Navos.
And it's every other Monday for 1 hour. It can be up to 2 hours. You only have to stay for the portion that your clients are being consulted on because we know how busy you all are. Okay, so then Paul Thompson, I'm doing these shout outs because there's so many people here, not necessarily in the audience, that have helped ECS and PACT be successful in the integrated healthcare model long before it was a strategic goal or an initiative. Paul Thompson had the idea of embedding a pharmacy intern into our program. And that was great because what she would do is actually look at the medication lists of clients coming out of Western State Hospital, look at how many medications the clients were on. She'd sit down with each client and ask them, how are you doing? What are the side effects of these medications? What are you feeling that you don't like? How would you like to feel? How has it changed since you started taking this or that? And really get into the complexity of all the different prescriptions they come out of the hospitals with and start changing them and taking them off of certain things or trying new things to improve their sleep or make their sex life better, make them feel better. Those were the top two, as the clients said, oh, my sex life's terrible and my sleep is awful. So it's really interesting. She had these conversations with the clients privately, and then she'd bring that feedback back to the site consult so that we could figure out how to better treat them. The other part of this, like Megan said, is evidence-based care. So PACT and ECS are housing first models and evidence-based care, and our intakes are reflecting this. We work very closely with the University of Washington. We actually have the University of Washington Medical School come out and train the PACT team on how to do better assessments, very detailed, tailored assessments, and they do that for free. They've actually paid us to be research lab rats for them, basically. So there's a lot of those opportunities. Our intakes have AIMS, diabetic, foot care, weight, spirituality, fitness, sleep, skincare, smoking cessation, and substance use treatment. I had one client come out of Western, and he was wearing a shoe that was several sizes too small. His foot was black and blue. He'd been wearing this size shoe for a couple of years. Not till we took them up to the public health clinic and he had his shoe measured, and he realized that that's why he had this terrible pain. It's just an example of the clients at Western, often as wonderful as Western is, they're not getting the doctor appointments, they're not getting the medical treatment. So when they come out, there are so many referrals. And what I have noticed is that as the client's medical care is treated, their mental health symptoms, the negative mental health symptoms do go down. So it's interesting, how I became interested in this is my first job was at Group Health. And after a year of being up at Group Health as a therapist, a brief it's called brief psychology, short sessions, 6 to 8 weeks. I left and a couple of doctors left and we decided to start our own practice. So the doctors would see the patients first, the clients first, and then they would refer them to me and we would consult on the clients together. And that's when I realized how important it was to treat the whole person. So when I came here to Navos, people said, well, I don't know if that really applies to this population. Absolutely applies to every population. It's treating the whole person, and it's the symbiotic relationship between the mental health and the physical health. The other thing I've noticed is jail visits and hospitalizations have gone down as we've been working closely with the public health clinic, and so the 911 calls have also gone down. Miriam Miyake and Angie Fry are wonderfully collaborating in integrated health with me now to offer SUD services. Those are 2 open benefits, and the county said that clients can access both of those. So when you think about the medical and mental health partnership, that also can include SUD, and so now we're going to have an SUD manager come to our site consults and provide interventions. I'm just thrilled about this.
Ravenna, maybe I missed it. What's SUD?
Substance use disorder treatment, so what we used to call chemical dependency, and so I actually thought of that when we had our audit because they said, gosh, you don't have enough chemical dependency interventions. Well, I don't have any CD specialists and I can't afford any for my program. I have just a small pocket of people that are using. So this is, again, a great way of collaborating with another department that has an expertise, saving money, and also just that teamwork. I mean, it's so refreshing to have other programs provide this. It makes the job a lot more exciting. And now on to Christina.
Well, I wanted to give one example of how we have collaborated with a community partner to provide an integrated care service, and that's the International Community and Health Services dental van. They have a mobile dental van unit. It has 2 dental chairs, 1 dentist, 2 dental hygienists, a program organizer who sets up the schedule and does the administrative side of things, and then their driver who also does data entry and scheduling when they're here on site. And you may have noticed the van before. They park over in the fruit stand parking lot area, and they come about once a month, on a Wednesday usually. They've provided over 95 hours of dental services to our clients, which we're very proud of. We started off in the pact program, and we got about a third of our clients to see a dentist, some of them for the first time in their lives. And as we know, dental care has been something that the funding has been there, and then it wasn't there, and then it is there, and then it's not there for Medicaid clients. Now dental care is covered by Medicaid, and so some of these clients, they haven't seen dentists in years and years, and it's really amazing that we're being able to provide that service for them here on site. The clients who live at Burien Heights just have to walk across the parking lot, and it's a partnership we're really proud of. They're going to be here at the health fair too, so I invite you all to stop by the dental van. They're going to have some open time that you can take a peek inside and see what it's like. And we have expanded the dental van offering to other programs. I want to give a shout out to Chantel Carter, who really helped me with getting some heart clients in. And if anyone has a client who's interested, it's a pretty simple sign-up process, but they can't do a walk-in on the same day. We need to get them signed up ahead of time just so that ICHS can run their dental history and make sure they aren't duplicating x-rays that have already been done within the past year. If they have, we can also work on requesting those records and they can still see the dental van. So Chantel and I both have the registration paperwork. I can also distribute that to supervisors, and please let your clients know, because this is a great collaboration for us.
Christina, how do we sign up patients? Do we send them to the front desk, or do we call you?
Yeah, you can give it to me. I have a one point person at ICHS, so we're trying to keep it as simple as possible. So yeah, if the new registrations can come through me. Thank you.
How many days a month do they come?
1 day a month, and so they have 10 one-hour appointments.
Is it possible to add more? I mean,
Yes, if we have a growing number of people, especially in summertime, because this is a service that they do a lot of work in the public school system in King County. So when school's out for the summer, they have even more openings. So if we start getting a lot more referrals, we can certainly add another day. And
So, actually, the next slide. Last night I put this together on my Apple really quickly. So, the next slide. So I just wanted to say a critical step in addressing. This was a really interesting. I think I'll save this one for later because we're running out of time. But it just talked about all the barriers that people put in place for integrated healthcare. Everywhere you turn, people are trying to put barriers in place, and our job is to remove those barriers and just make it happen. I'm really proud that Navos has been doing that. And we're going to continue to do that even more. So here it talks balancing the 6 dynamics. So vision and leadership, clarity on the objectives. So Cassie, Megan, and David have said, let's get going. We have it as a strategic goal, which is integrated healthcare. Our infrastructure's changing, striking the right balance between strong leadership and vision from the top, and room for bottom-up and experimentation and innovation. Woohoo! So that's where I've gotten to just totally take this and run with it. Like, hey, what about having SED counselors come over here and we can work together? Hey, what about getting gym memberships? Is that okay? Yeah, we're gonna go do it. Okay, woohoo! Hey, what about doing a yoga class? What about a walking group? Now we have a yoga class, a walking group. I have a martial arts, somebody that teaches martial arts as a case manager, and he does stretching groups for the clients. And most recently, I have a cooking class that's super popular. The governor actually came out to eat our stew last summer. And we grow our vegetables in our garden, and we actually create recipes out of these delicious vegetables. So don't think that you can't be creative here at Navos. If you have any ideas about how to create more integrated healthcare, email me, and I'll also help make it happen for you. Frontline healthcare delivery works in parallel with strategic change management at the organizational level. So it's not just top-down, it's everybody coming up with creative ideas together. And I know David Johnson and Megan Kelly and Cassie will completely support you in your creativity. That's been my experience. Okay, so here's you in the middle, the client or the staff. I always talk to staff and say, well, how would you feel when we're talking about clients? Well, what would you do? What would you tell your friend? It's like looking in the mirror. How would you handle this? So here's you in the middle. Relationships, communication, physical environment, professional development, nutrition, movement, mind-body connection, spirituality. I know I'm low on the movement area. After being in California, I really felt low. I was like, wow, it took me 3 days to get moving and get back into it because I'm from the Northwest where it's raining every day. So just using these sorts of graphs with clients can be really helpful in addressing integrated healthcare. I wanted to add a little humor at the end. Everyone agrees to help reduce healthcare costs. I can't afford that diagnosis. Do you have a cheaper one? Of course it's not downloading your iTunes. That's your 24-hour heart monitor. I like that one. Your insurance covers a warm hug or a hearty handshake from the pharmacist, but not both. And so here in ECS Impact, we want to have the warm handshake and the hearty hug. He left and retired, but we still do the hearty hug. And this is our team having breakfast. So if you're thinking about, well, how do I do this? I don't want to do this on my own. You don't have to. It's just being part of a team. So in the summer, we do breakfast once a month. Al Kamara gets the huge thing of jug of milk for really cheap at one of the discount stores in Burien. And we have the Cheerios. And that's my son coming to work to enjoy Cheerios before summer camp. And we sit down, we eat breakfast together, and we just talk about, how are we going to make this happen? How are we going to measure this? What's our goal? We've met our goal of 100% clients in ECS linked up to public health. What's our next goal? I'd like half the clients in ECS to be enrolled in the walking group and doing it regularly. How am I going to measure that? What assessment am I going to use on the front end, and how am I going to measure that so that when auditors come in, they can see that we're actually doing this? I'm doing this because I know it works. It's the holistic viewpoint. I love medicine. Barry was like, why don't you go to medical school? Because I love being a therapist. I just like too much of all of this. So if you want, email me and we can have more dialogue about how to make this happen moving forward. Thank you so much for being here.